Welcome everybody to another Campfire Project panel discussion. And today we are talking about mental health in current times. And I'm really delighted to have with me people from different countries and different continents with different cultural backgrounds. And I really look forward to having a discussion about what matters at the moment most. So would you please introduce yourself? Go with, who you are. Martyn, do you want to start?
Hi, I'm Martyn. I'm in Melbourne, and I'm an emotional intelligence coach.
Who goes next? Anne?
Okay, hi everyone. My name is Anne Crook. I'm in Nashville, Tennessee in the United States, and I'm a certified integrative health coach and a holding space consultant, and I specialize in mental health and wellness.
Hi, I'm Adam Duval. I'm the founder of the Mental Health Warriors organization, and I'm based in the UK.
And I am Angela Heise. I'm a leadership coach and emotional intelligence trainer, and I'm in Brisbane, Australia. So, Adam, this was your idea. You're the mental health warrior. Everybody here is really interested in mental health. So what is really important to you at the moment?
What's important to me right now, and that is to end the stigma of mental health.
Okay, and what specifically about that?
Because there's just that stigma of not many people either talking about it or not understanding it enough. So obviously that's why I created the Mental Health Warriors over a year ago now, from personal experiences myself due to childhood trauma, and it's time to give back, and we're on this mission, and yeah, and we're going to do it, and we won't stop until it's done.
So what's your goal?
To actually, because I know we're going to die one day, and I want to be remembered as the guy that created the Mental Health Warriors, and that he stopped the stigma of mental health. That's my goal. Great.
Okay. So I'm just going to hand it over because I don't want to be the one asking questions all the time. It's a discussion. So somebody else's perspective on mental health at the moment.
Well, I agree with Adam that there's so much stigma around mental health. And I know for me, growing up with my mother who had lots of mental health issues, I was terrified of mental health. And then my first partner was bipolar, or is bipolar. So I've been around it my whole life. So I think getting rid of the stigma is a great goal. Yeah.
And I have to piggyback on what Martyn and Adam said about getting rid of the stigma, because it's a huge problem. There's no reason why mental health should be any less important than another major chronic condition like diabetes or cancer. And here in the United States, it is also a stigma, and we're trying to, get past that. And the more people speak out about how important our mental health is, especially in times of COVID, numbers are increasing. Anxiety and depression has been through the roof for many people. So just talking about it is part of getting rid of the stigma.
I saw a recent LinkedIn polls, how they always do these polls, and it was saying, how comfortable do you feel talking about mental health at work? Whenever, and people, 60%, I think it was 60% of people said, no, they don't feel comfortable talking about it. Now that's still left 40% of people who were. So I think it's a good trend, because I remember times where people were saying, well, you've got depression. It's the equivalent, just get over it. It's the equivalent of saying to somebody who broke a leg, I'll just keep walking, it's going to heal itself.
Exactly. And that's why it affects men, and men are so isolated and very reluctant to actually speaking out about mental health, because they're always getting told, oh, stop feeling sorry for yourselves, just man up. And 9 times out of 10, that can actually be a trigger to them.
I think for me, I know when I've, felt down or flat, or I probably don't talk about it that much, because for me, it's about safety. So it depends who I'm with. If I can really express myself fully, or just, oh yeah, I'm okay, you know. And I find a lot of people here at the moment I'm talking to, I'm a bit flat, that's what I'm getting. And then I try and, you know, probe a little deeper, how are you really feeling? And again, it depends who it is, whether they open up or not. But that's been my experience lately for me and people around me.
I would love to hear more about what are the approaches that the healthcare industry is taking in your countries. I know here in the United States, the mental healthcare system often is looking from the disease model of diagnosing and treating with medication, and then talk therapy. And that's sort of the standard course when you get conventional treatment. Now, I myself, as a certified health coach, come from an integrative approach where it's a body, mind, spirit issue that needs to be addressed. You can't address just the physiology. You can't just address the mind. You can't just address the spirit or the emotions. It's all combined. It has to be what we call is a multifactorial approach. You have to look at the whole shebang. And oftentimes, you know, it could be something as simple as you're eating the wrong foods and you've got some kind of nutritional deficiency that's driving depression or inflammation, or you've got a gut issue. You've got a problem with the microbiome in your gut, and which causes inflammation, which actually goes up to the brain through the vagus nerve and causes neuroinflammation. So I'm not sure if you all are talking about these things in your healthcare industry, but that's starting to come out in the United States, is looking at this from an inflammatory model versus just the mind. Yeah.
Well, I'll just, the multivagal theory is something that's fairly new. I mean, we have never really considered the vagus nerve until recently, and the whole brain-gut connection. I mean, with that, the fact that the immune system sits in the gut, or 80% of it, that's nothing that people are really aware of, really. I mean, like we still talk about, let's talk about it, but sometimes talking can make it actually worse. You know, if I keep repeating the same story over and over again, it could become my identity. It becomes who I am. I am a person who struggles. I am a person who has issues. I am, you know, so again, yes, I love the integrated approach.
Yeah, absolutely. Yeah, and obviously it's it goes back to being branded with that label, because that's what mental health is. Because I believe mental health is health. Doesn't matter if it's physical, spiritual, it's just health. And obviously I always believe life always starts with your mindset.
Yes.
And obviously I can talk only from experience. I can second what you're saying, and I really do agree. But the UK industry in NHS, because that's what we go over here, with my experience, I think they're going downhill massively, because it's actually been branded that COVID has been the biggest threat to mental health since World War II. And therapists are being degraded like down massively, and prescription medication that 9 times out of 10 those medications are not going to work, but they're on their increase.
Yeah.
I think here in Australia, I mean, I'm not totally 100% sure, but from my feeling is that a lot of doctors are still would just be giving out medications for mental health issues. And I think if you told, you know, most people who are suffering mental health, well, maybe it's something in your diet, they'd probably think, you know, I was crazy. That's, I mean, I agree with integrative, absolutely, but I think that's my feeling. What do you feel, Angela, here?
I'm sorry.
What do you feel in Australia? Is that where how, you know, how the health system is around mental health right now?
I think we're still treating the disease. I don't think we have moved from that. I mean, that's why, I mean, talking about the vagus nerve, I actually did a presentation about that some time ago, and people were going, what's the vagus nerve? It's the biggest nerve that runs through your whole body that impacts on all your organs. You know, you manage that, you calm down your parasympathetic nervous system, you know, you can do all of these things. People don't deal with that.
No.
Still, I know that in Australia, calls to helplines have gone through the roof. And I want to make really sure that everybody understands that when I talk about that talk therapy can actually deepen depression, I am not talking about reaching out and talking to people and saying, I'm struggling, things are going wrong. I think that's absolutely crucial. And I think that's really helping. But it's in the long run, what do we do? And that's where the integrative approach that Anne was talking about, things comes in really handy. Not handy, it's crucial.
Yeah.
Yes, absolutely. And to, go along with reaching out, there are other types of therapy that kind of go beyond the, I guess it's called the prefrontal cortex, the thinking mind, that's not going to really have much of a solution for depression when you just talk and talk and talk. But when you can go back to the limbic system, which is where all the emotions are stored, through some of these trauma therapies that are starting to get very popular in the United States, like EMDR and brain spotting. It gets right to the root of the trauma and where it's stored in the brain. And that can really relieve a lot of symptoms of depression and anxiety for people.
Absolutely.
Are those therapies being used in Australia and the UK?
Adam?
I don't know.
I don't think they are, no. Like, I actually referred myself to EMDR, for EMDR therapy via the NHS, actually very recent. And obviously I had the assessment, which was pretty quick, which I was very surprised about. And because I only had to wait 2 weeks, which normally you have to wait up to about a year to actually be spoken to. And that's why suicide rates are on the increase massively here in the UK. And yet they put me through to CBT instead of the EMDR. I'm like, I wanted the EMDR, not CBT.
Okay, could we maybe clarify for people watching what EMDR and what CBT are? Because we know these expressions, they make perfect sense to us, but probably not to people around us.
Yeah, CBT is practically the stage. It's branded as cognitive behavioral therapy, which is like one step down from EMDR therapy. But I believe I can't remember what EMDR stands for. I can't remember, but
and knows.
Yeah, it's eye movement desensitization. Let's wait, EMDR, eye movement desensitization reprocessing.
There you go. But I believe the reason, I'm probably wrong, but I believe I never got put through to EMDR because it's going to cost the NHS a lot of money for that. That's just my opinion.
Okay, so we now have identified what the acronyms stand for. We still haven't said what exactly CBT and EMDR do. So maybe Anne, could you enlighten us about EMDR?
Sure. So EMDR is, like I mentioned, it's a trauma therapy. So actually I was serving as the health and wellness coach with a team of mental health therapists here in Nashville at a recovery center. And oftentimes these therapists that were doing, talk therapy with clients were also doing EMDR. And they would, take them through an assessment to decide if they need a greater level of therapy. And then I was coming in as the health and wellness coach to work with the food and the lifestyle and the stress levels and the gut and all of that. But back to EMDR. So EMDR specializes in unresolved trauma that gets stored in the body. And as I was mentioned, we have the limbic brain, which is in the back of the brain, which also includes the amygdala and the reptilian brain. And we store our emotions there, especially traumatic emotions. And so that part of our brain doesn't understand the difference between you at age 35 or you at age 5. And so what EMDR does is it goes in and it targets, there's a switch that you put in your hand where it buzzes back and forth, but it's actually triggering that part of your brain. Or sometimes with brain spotting, which is similar to EMDR, the man that developed brain spotting actually was using that from his EMDR, and then he took it one step further. And so they use a wand with a red dot, and they just go back and forth, and it has something to do with your vision. And when your vision, depending on where they raise it, up or down, triggers this part of your brain, the limbic, and all of a sudden you're weeping or you're sobbing or you're feeling something in your body and you weren't even talking about it. So it's very powerful.
Wow.
Yeah.
Mm.
It depends on where you direct your eyes. You can access memories, you can access inner conversation with yourself, feelings, all sorts of things. And they are
I guess we'll have to start with you, Angela, and go back to what were we talking about? What were you saying when you got cut off?
we were talking about EMDR.
Yeah.
And you know, how you know, we access different parts of the brain through moving the eyes around
Oh, okay.
different ways. Yeah.
Okay.
Okay. All right. So we access all of that. What do we do when we do CBT? So cognitive behavioral therapy. I mean, that's very different.
Yeah.
Adam, you're the one who has the experience.
Well, I've never had experience with cognitive behavioral therapy. I've never had experience with that. But what I know about it is it's not as good as EMDR. It's not as good.
Well, from what I understand, and I'm not an expert in this, is that, Martin, do you know?
No.
Okay.
No.
It's taking the self-talk that you have in your head and you write it down. And you then analyze it and what it stands for and what it means. So it's becoming aware of the unconscious processes that you run in your head and the conversations that you have with yourself. And there's a lot of diarizing and a lot of becoming really clear on what's going on for you. Because we do a lot of talking to ourselves. We just often don't know. And the thing is that I find is we often talk in somebody else's voice to ourselves. So I can have my mother's voice in my head, or somebody who has massive impact on my beliefs, for example, you know, that I'm not good enough, or that, you know, that I just shouldn't be doing this, or whatever it might be. So being able to access that and then saying, you know, well, maybe this is really useful. That's a totally different story. But again, I mean, you can take it with EMDR, you can take it a step further. You don't have to process it consciously. You know, you can just let it go, which I think sometimes is a really good option.
Mm.
Has anybody got any other modalities that they can think of where you can process stress and trauma without having to actually bring it up and talk about it again?
Well, one that's coming to my mind is called cranial sacral therapy. Have you all heard of cranial sacral work?
Yeah.
Yes.
And it works with the nervous system, and it can bring up a lot of stored emotions in the body, including trauma. And really help to release it without having to go through a whole like life story about, you know, talking. Yeah. So
Adam, when we were talking about stigma before, I mean, like, this is, look, I want to make sure that everybody contributes, because I feel like I'm doing a lot of talking, that you can actually release emotions. And this is the thing, is as we rationalizing, this is when I talk about talk therapy, rationalizing why I'm feeling a certain way. We can do this until the cows come home. And that's what actually leads to potentially more problems. Is the stigma around actually feeling our emotions and expressing them? I mean, like, crying is a wonderful thing, but we don't cry nearly as much because you're not supposed to, right?
Yeah, absolutely. Crying shows strength. I can't get any simpler than that. But yeah, I believe with stress, it's always a choice, and you always have to question, well, why are we stressed? Why are we stressing with ourselves? You always have to tap into your own subconscious mind and question, why is this happening?
Martin?
Yeah, I mean, I use powerful questions with people who might be in their story, you know, stuck in their story. Or, I mean, I've got one particular friend who's the glass is always half empty. So, you know, I might, we were talking about beliefs a minute ago. So I might, you know, I often question people, is that your belief? And they look at you like, what? I was coaching a young woman one day who said her job was stressful and she doesn't always cope with it, and she should be able to cope with it.
Yeah.
And I said, really? I said, is that your belief? And she's like, and then she thought about it. She said, oh my God, that's That's my mother's belief.
Uh-huh.
Yeah.
And I said, yeah, so how about, the job is sometimes stressful. I don't always cope with that. And that's okay. She says, oh my God, that sounds so much lighter.
Yeah.
So offering a new perspective, or I might ask someone, is that the absolute truth?
Mm.
So
Yes.
just, a simple question, but it's not one that they can just, that's why I never ask why questions, because why questions take people straight into their story. So you will, rephrase it. But I find simple questions can be really helpful.
Mm.
Exactly. See, what I did with my 9-year-old son, like because he's got autism and ADHD diagnosis, and when he was in meltdown, when he was in crisis, he was saying some nasty words and stuff like that to us. So we got him to follow us, and I gave him a glass, and I just said, right, drop it on the floor. So he did, and obviously it smashed. I'm like, right, apologise to it, which he did. And I said, right, okay, pick it up. But he obviously never picked it up. I said, well, can you put it back together? No. Well, but there you go then. On the outside, you're looking whole, but inside you're shattered because of the words. And that's what not many people actually realise. And that's just one of the methods we actually teach these kids.
Yeah.
So we don't, sorry, Martin, go.
No, I was going to say, before you were talking about, the stigma, I think a lot of it is judgment. People are afraid of judgment.
Yeah. I agree.
It's very simple, because mental health isn't okay. So I'm going to be judged. And that's why, as we know, especially men, I think, the suicide rates. So men's groups are, if are safe places for guys to go and to be able to talk about anything. So I think in these times, I don't know, for me, it's finding a community, it's finding safe spaces to go to, whether it's online or in person, because in my experience, a lot of people around me, they don't really want to know how you are. They might ask you how you are, but they, so, and, I pick up on that energy, so I wouldn't share. But I often feel safer with a group of people I maybe don't know that well.
Speaking of stigma, I'm wondering how common it is for people to take SSRIs, the serotonin reuptake inhibitor medication, the antidepressants, in your countries, and is there stigma around taking medication? Because I found here that so many people take SSRIs that you would never think of, but but the more common you hear, you find out it kind of starts to take away the stigma. So I'm just curious, is there a lot of stigma around taking a pill for depression or anxiety, for example? Or is it just around having depression or anxiety?
I would say no to the pill. I don't think it is a stigma.
To taking a medication?
Yeah, generally.
Yeah, I think turning to the medication is the easy way. Yeah, just because they think it's going to get rid of the pain, and that's the mindset telling them that, but it's just numbing it, temporary.
Of course.
Yeah.
And then obviously here in the UK, the doctors, they're always going for the lower dose, the lowest dose of medication, whether it's ibuprofen, cocodamol, paracetamol, and obviously after a few months of this patient being on these medication, it's clearly not working, so they go back and they're always upping the dose. It's not doing nothing.
Yeah, well, I know that when we, and I don't know what it's like at the moment. I mean, I've tried to find some numbers and figures, but what is happening in Australia at the moment with regards to mental health and suicides and all of that, and there's not a lot available. They're not really giving out the numbers. I don't know. Maybe there's a sense of it's going to make it worse if we tell people how bad it really is. But when I talk to people, they say, well, it's actually pretty bad, but pills are really an accepted way, because I mean, you can go to a doctor, and in Australia, antidepressant medication is prescribed generally by a GP, and a GP doesn't have, so a general practitioner doesn't have the necessary, I'm not saying this about all GPs, but a lot of the time a GP does not have the psychological training to actually be able to assess whether somebody needs an antidepressant or not.
Right.
So I've had clients, I had one client, for example, who had just lost his wife. He had cared through cancer for 3 years, and she died. He went to see his doctor. 2 weeks after she died, he was on antidepressants. So we need to process emotions. Grief is absolutely crucial for resetting the system. And I'm saying system very lightly, but putting a drug on top of that artificially stimulates the system does not allow us to actually process the emotions. And I've heard over and over again, you know, like, I've separated from my girlfriend. I was really sad. I went to my GP. I got an antidepressant. Literally with a short period of time of having this effect. So what we're teaching people is that mental health is something that you can fix with a pill. But I've also talked to people who've been on antidepressants for 10, 15 years. They're not supposed to be taken that long. You know, they are supposed to be taken for a short period of time, and then you reset yourself. But let me put it this way, you know, there are benefits to having people on tablets. So, you know, and be giving and saying to people, you know, you don't have to take responsibility for your mental health, I think is a dangerous route.
Yes.
It's an easy fix.
It is.
And I've got friends who love easy fixes. So they'll take pills. You know, it's just an easy fix. So I don't have to do anything. I don't have to change my diet or, it's sad. It's really sad, but I find that it's often, you know, quite prevalent.
Yeah, to really heal, we really have to take agency over our own health to heal, you know, have the support of a doctor. And like you said, Angela, antidepressants can be a good remedy for a time, but they're not meant for life. You know, and I don't know, I would actually say for some patients, you know, who have severe bipolar or manic, maybe it is life, maybe it is.
Yeah.
So, you know, it depends on the severity of the mental health issue. But for somebody who's grieving the loss of a loved one, I absolutely wholeheartedly agree with you. I mean, I partner with an institute here in the United States. It's actually worldwide, but it's called the Institute for the Study of Birth, Breath, and Death. And I'm one of their consultants, and I've been trained to hold space for grief and loss and difficult emotions that get stored in the body, because a lot of times it's actually not depression you're having, it's grief. And it can show up as depression. And it's important to honor that in the body. So, but again, it goes back to safety. I think what both Martyn and Adam were talking about earlier is the emotional safety. If you're not feeling safe, you're not going to talk about it. So just having that compassionate presence.
Okay, so instead of sending people to doctors and saying, here, go and get an antidepressant, what would be a better way of dealing with this? I mean, it's a rhetorical question, but let's call it.
No, you're right. You're right. I would say definitely talk to people that has been in your shoes. Absolutely. Because I believe, and obviously I don't know what it's like in other countries, but I believe turning to someone that has hit rock bottom, they've got a better understanding than what the professionals do.
Well, I mean, let's just be really clear. We're not saying do not go to a doctor.
Oh, no.
But go and talk to people about it.
Yeah.
And let go of your emotions. Feel your emotions, right?
Absolutely.
Yeah.
As Adam said, it's a great strength to be vulnerable and to cry.
Oh yeah.
You know. It took me a long time to learn that, but when I got that, it was like, whoa, because, you know, as a boy growing up in England, it wasn't okay. It was made you weak.
Yeah.
That was my perception. But I'm happy to say that's now very much changed.
Yeah. Well, thanks.
Sorry?
Slowly changed.
Yeah.
Yeah. Well, the good news is that lots of movies coming out of Hollywood, which are directed at 13-year-old boys mostly, they are now, they often have men crying. That's something I've observed. And so that means things are changing. Because it used to be the John Wayne model, you know, just toughen it up, as Adam was saying, and man up and just get through it.
Yeah.
Right.
Yeah. Goodness.
Yeah. I mean, we're human. we're
Yeah.
designed to have a range of emotions, you know?
Absolutely.
Yeah.
Yeah. I was on a workshop last Sunday, a safe space workshop, and the presenter was a guy, and he just started talking initially about what, you know, the week he'd had and what we're going to do, and he was getting emotional, and he said, I didn't expect that, but I mean, he was fine with it. It's one thing I love about him, and it was really such a safe space. I mean, he played a song and the words just got to me. I mean, I was sobbing. It was just, but I felt, you know, it is what it is. And I think, yeah, if we can encourage people to open up and share and be vulnerable, then, so yeah, where do we go from here?
Well, I love the idea of what we're doing right now, having a Campfire Project discussion, talking about it from different world perspectives, because just finding out, you know, how is it in your part of the world and how can we make this better? It's kind of like just taking one step forward in our shared humanity. You know, at the end of the day, it's like, we're not just men or women or transgender or whatever your gender identity is. We're humans, you know, we're having a human experience. And you know, like we were saying, that includes a range of these emotions, and it's learning not to pathologize grief or pathologize the difficult emotions that don't look so rosy. But really, we heal as a community. I used to work at this recovery center, and the clinical director used to say, we're wounded in relationship and we heal in relationship. So, you know, we heal through community.
Yeah.
Yeah. So I don't know, that's my 2 cents about just having these discussions. What do you all think about next steps?
Well, I mean, it's a big question, isn't it? We all have to, I guess we're all doing our bit, and we have to continue to do our bit with the people, you know, the people we can support around us, in education, as Adam said, you know, really talking about, well, and I mean, we all agree, integrative approach. So talking about, you know, diet and positive things to do for your mental health. I know if I'm having a bit of a, you know, a flat day in lockdown, and the Melbourne weather doesn't often help, you know, I need to get out, I need to walk, I need to move my body, I need to eat well, talk to positive people, you know, just those, yeah. Those, and I think encouraging other people to do the same. I think we're getting there, but it's a slow process.
Absolutely. And I admit, obviously with all these restrictions, luckily UK is not restricted. We're still open, and I hope it stays like that. But for the first 2 weeks in March 2020, I was thinking, what's going on here? And my mental health was deteriorating. But then I thought about it, and ever since, I've seen every day as an opportunity, because I'm connecting with like-minded people that want to change the world of mental health, and this is what I do. I connect with everyone all across the world now.
Yeah, great.
Yeah.
How about you, Angela?
Well, I would say that the thing that would really make a difference is being able to, for all of us to learn to actually hold space for somebody who's going through something. And that just means that the average person listens for 17 seconds before they make a suggestion for fixing something. You can't really get any information, but if we learn to just listen and without judgment, and being comfortable with somebody being in distress. And I'm not saying that we should sit there and go, you're in distress and, you know, that's okay. I'm saying feel the empathy, but don't get sucked into the drama. Don't teach people how to do that. We teach people either to be fine, and I describe that as fucked up, irrational, neurotic, emotionally unavailable. So I'm fine, you know, like, and that's what people say, you know, how are you? I'm fine. Don't talk to me. So to be able to say, and I do this with my clients. So how are you feeling today? Fine. Okay, great. Now with that, we've got that out of the way. Tell me how you really feel. And people often don't even have the words for it. You know, I'm good, but that's a judgment on the feeling you're having. Or not too bad. That's my favorite. Not too bad. What does that mean? So getting into, I'm feeling, you know, melancholic, or I'm feeling sad, or I'm feeling frustrated or impatient, or whatever it might be. If we focus, it's much easier to identify the negative, the unpleasant emotions. The positive ones, or the pleasant ones, are so diffuse, we ignore them. Right? Yeah, I'm really happy right now. It doesn't register. But when we teach people that negative emotions are really useful, and that it's okay for somebody to say, you know, I'm really depressed today. And somebody just says, how can I support you? Or just listen to me. Great.
Yeah. See, my son's got anxiety along with his autism and all that. And like I said earlier, he keeps throwing negative comments on it. And all I'm doing is replying, okay, I love you. I love you. And I keep saying that because it's reminding him, and he keeps saying, stop repeating. And I just say, I love you. I love you. And he soon quit. That's what he does. Because that's what you do. You just come across positive, and they get bored after a bit.
Yeah. I think another great step forward too is also education. I always tell my clients that knowledge is power. And when we don't know what we don't know, then we can't help ourselves to feel better. But when we understand things, like I was talking about earlier, that depression's not just in the brain, it's in the gut, it's in the nervous system, and I'm speaking for, you know, a range of mental health issues, anxiety as well. Then we have that knowledge and we can start applying it, and then we feel empowered that, like, okay, yes, there's our doctor, and yes, we need a doctor at times, but at times we can empower ourselves to take our agency over our body and start to learn about it and find those foods or find the lifestyle habits that make us feel great. And we don't need to rely on a medication necessarily. You know, I'm not saying that for everybody. Some people, like when it's severe, medication is necessary. But for somebody that's dealing with a divorce or the loss of a loved one or a death, they might just need time for grieving and healing. And there are actually foods that I teach my clients, like omega-3 fats are amazing to buffer depression, to help the body through that time of grief and loss. So knowledge.
I agree on all of that. I think, you know, medication is important in certain cases. You know, my ex was on medication for bipolar, and he would often leave it off for a few days. After like 2 or 3 days, oh my goodness, it was so black to be in that space. I would say, please take your medication.
But we're not talking about clinical, you know, but we're talking about everyday mental health and what we can do to support ourselves. And yes, and there's trauma, and we process trauma in different ways. And, you know, I'm just thinking, I mean, I don't know, Richmond, if you're watching this, but Richmond Heise is the Australian TRE person, trauma release or tremor release exercises. If you haven't heard of it, this is a brilliant way to just reset your system at night, again, to just calm down the vagus nerve. And they've used this very successfully also with veterans with PTSD. I have personally released trauma from car accidents and things with this technique. It's basically you allow the body to shake.
Oh yes, I've done it. Yes,
it's brilliant. Yeah. So that's a very simple way that everybody can use every night. You can do it lying in bed, you can do it standing up, you can do it, you know, just allow your body to reset. You don't have to process, you don't have to, and in terms of verbalizing what's going on, it's just about giving the body the opportunity to just let go.
Yeah.
Well,
Yeah.
when I've started, and obviously I'm saying that it works for me. It may not work for others, but I grew up being addicted to medication, and I was in and out of hospital every 6 months because of it growing up. But then obviously I don't take medication at all. I don't. But now I actually do aromatherapy now, and so I've got myself a diffuser, and I'm all with that essential oils now.
Yes.
And you know what? It's very beneficial. Very beneficial.
Yeah, I've heard that as well. Which essential oils have you found that are especially good for balancing your mood?
Well, if you want to knock me out, lavender.
Yes. Yeah.
Mhm.
Yeah.
No, I've got sweet orange, frankincense, eucalyptus. Yeah, they're really good.
Yeah.
Yeah.
Basil is good for focus. Lemon is great. Orange stimulates conversation. They're brilliant essential oils. Yeah, I love them. I've diffused. I've got a whole drawer full of oils.
Yeah.
I've got one right behind me.
Me too. Yeah.
Yeah. So there are lots of different ways in which we can actually do things that support us on a daily basis,
Oh,
right?
absolutely.
Yes.
I mean, I often get on my yoga mat for 10 or 15 minutes, but I feel so good after.
Oh yeah. Oh, and then have you all ever heard of the term forest bathing? It's a Japanese term, Shinrin Yoku.
Yes.
The Japanese tradition, just going into the forest, going into the woods actually lifts your mood up.
Yeah.
And it actually supports your immune system. There's so many health benefits of just taking a hike.
Yeah.
So
Yeah.
Getting into nature. Yep.
Yeah.
Nature, yeah.
Or very simple, give someone a hug.
Oh yeah.
You know, I'm not talking about being the black hole who goes in and says, I need a hug right now. I'm talking about, it's just, you know, like just because a 30-second hug releases oxytocin, which is the trust chemical, which is, you know, helps us, you know, bond with people. And we need more of that. I mean, I know in lockdown times that can be really difficult. And I know that last year for me was really difficult. I averaged my hugs per month by 0.5. You know, that was tough. That was really tough.
Yeah.
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 I agree. Yeah.
Absolutely. And obviously to benefit Scott as well, a simple smile.
Yes.
Oh yeah.
Carson, yay.
Yeah.
And Jamie. Yeah.
Okay. True.
Yeah.
So I love the fact that we started talking out as mental health as a problem, really. And what we're doing right now is we're going into, wow, there are so many different ways in which we can be mindful and support our mental health.
Yes.
Is that the way forward?
Absolutely.
Yeah. Integrative approach, you know, just and nobody's going to have the same formula, you know, like what works for me might be different than what works for Angela or Adam or Martin.
Yeah.
So finding what works for you.
Yeah. Great.
Exactly. Yeah.
Good. Okay. Well, I'm very mindful of the time, and we've had some technical problems that really interrupted the whole thing. But I would say, and I just want to honor your time as well. So maybe if we could just finish this by, if everybody could just have one final thing that they could say about what is really important and what you suggest, or anything that you want to share. Oh my God, crickets have said everything.
Yeah, so much. I think if anyone's struggling, you know, to talk to someone they trust.
Yeah.
And as you said earlier, you know, listening is a great skill, and we all want to be heard. We don't want to have we don't want to be heard when someone's thinking about what they're saying next. We just need to sit and listen and look at and giving the person the, you know, the time and the attention they deserve, and looking into their eyes, I think is really powerful. Looking into people. I love looking into people's eyes, even though some people not comfortable with that, but I think it's just a beautiful thing to do. But yeah.
Yeah, I totally agree. And for everyone that hits rock bottom, yeah, it does feel like a dark place and the walls are closing in on you. But see, it's a positive as well, because you're rock bottom. The only way is up. There you go.
Yeah.
Yeah. And I would just add to that to create a healing mindset. And in so doing that, like when you think about depression or anxiety, like as a message from your body, like just come from a place of compassion as you would a best friend. Like something's out of balance. My body's talking to me. So how can I work with my body versus against it? And not to shame yourself, but to know that everybody goes through hard times, hard feelings at times, and even depression. But when you have that healing mindset, which is growth oriented, it's actually, it really helps to kind of just get you to overcome the adversity and to get you into a better place. Mindset is huge.
Absolutely.
Yeah.
So it's for me, it's the recognition that we can be comfortable, that we can become comfortable with being uncomfortable. You know, that it's a signal that says, here, pay attention to this. And when we do, it changes and we grow from that, as you were saying, Anne. and we can actually, we get stronger all the time, as you were saying, you know, like Adam, like the only way is up. And listening, I think, yeah.
I love that. There's a field of study actually called post-traumatic growth. Have you all heard of that?
Oh,
Yeah.
How you can actually grow and become even better from traumatic experiences.
Wow.
Yeah. So that's
well,
yeah, I keep saying to people, like we've mentioned depression numerous times in this stream, but if you actually write the word depression on a piece of paper, then start taking the letters out of that word, change it into a statement, I pressed on.
What? Say that again.
Last bit.
The word depression, if you actually take the letters out of that word, change it into a statement, I pressed on.
Ah, I press on. Okay. Yeah.
Oh, wow.
Cool.
nice.
Yeah. Great way to end.
Yeah.
Thank you all. It's been absolutely delightful. And I know we've just scratched the surface, but hopefully this is giving people some idea of how many options there are out there to support mental health. And of course, as always, the Campfire community is the place to go to get the support. Martin and Kim are running a drop-in at the moment every Wednesday night, so people can come in and talk on Zoom. So please make use of that. It's you know, we're here for each other. That's what really matters. Yeah. So thank you all from the bottom of my heart, and thanks everybody for watching, and we'll see you soon.
Thank you, Angela.